Good morning and welcome to the Meet Your Future Health and Social Care 2025 webinar. I'm Ailish Peters, part of the Education Work and Skills team at Greater Manchester Combined Authority. For those who have joined us before, you might be aware that Meet Your Future launched in 2019 by Andy Burnham, Mayor of Greater Manchester, to give young people like you the chance to meet real employers and explore different career paths. We have developed a suite of information, resources and services that are there to help you, and this can be found on GMAX, which many of you will already be familiar with. Please speak to your teacher to find out more about this, and I'll also drop a link to it in the chat. We hope this session inspires you and helps you feel more confident about your future in Greater Manchester. In today's session, you'll be hearing from Sue Howard from NHS Greater Manchester. Please make use of the question box for any questions or thoughts you might have throughout the session. You will see this on the right-hand side of the screen, and we will be publishing any questions that come through. Please ask your teacher to put any questions you have into this box, and please don't be shy, and we'll cover these in the Q&A section at the end. If you would like to use captions or subtitles during the event, please select captions/subtitles on in your video controls. I'll now hand over to Sue. Thank you, and over to you.
Thank you. So hi, I'm Sue, and I'm from NHS Greater Manchester, and I'm going to talk to you today about health and social care careers. So we are actually made up of thousands of different organisations, some really small, some up to 30,000 staff are employed, but we all work together as part of one large system. We actually employ nearly 1 in 6 employed people in Greater Manchester. So that's huge numbers of staff working in our sector. So if you're watching this in an assembly, potentially say 200 people, about 50 of you will come and work in health and social care in the future. And if you were watching this in a classroom setting of say 30, about 5 of you will come and join us as well and be employed in one of our roles. So we are a huge employer collectively. So I'm going to start with a bit of a quiz. So the first question is, you have to work in a hospital to work for health and social care. True or false? I'll give you a moment to think about it. You can call out in your rooms if you wish, or just think about the answer you would give. So the answer is false. We work across a real range of settings in GP practices, in pharmacists, in high street opticians, in care homes, even in people's own homes. We work in a real range of spaces, not just hospitals. Question 2, how many professions do you think there are in health and social care? So how many different types of roles? 100, 200 or 350? There are actually 350 different roles in health and social care. So a huge variety of options and career routes available to you. This is a busy slide, so I don't expect you to read it all, but it gives you a sense of the range of roles that we have available. And this isn't all of them, this is just a snapshot. I actually went to my daughter's high school careers fair a few months ago and spoke to about 50 young people that were interested in coming into health and social care sector. And between them, they only mentioned 5 roles: nursing, doctor, pharmacist, mental health nurse and midwife. But that was just 5 roles. As you can see here, there are a huge number of options available to you. And it's not all about clinical careers either. We also have huge numbers of HR staff, finance, digital teams, managers, engineers, scientists, you name it, we've got it, because it's huge, this. So there are huge numbers of options. Our staff are the absolute backbone of how we provide our services 24/7, 365 days a year, and we all work together as part of one cohesive team. Every job you see here is absolutely pivotal, and we've highlighted a few just where we think there are some extra needs going forward, so in the next 10 and 20 years. So, for example, we are going to need extra care workers to support older people because we have an ageing population. We're going to need more mental health professionals like counsellors and therapists because so many people are needing support coping with stress and anxiety. Paramedics and ambulance staff are always in high demand to respond to emergency situations. Community nurses and midwives are needed to help people stay well at home. And we're seeing growing roles for pharmacists and public health teams to try and prevent illness before it starts to happen. And as I mentioned, there's a whole infrastructure behind all of this that helps keep things working smoothly, paying wages, keeping IT running, people looking after the buildings and the spaces that we work in. There's a huge range of an infrastructure behind the scenes as well. And what's great is about how all these roles interconnect. So no matter where you start, once you get into the health and care sector, you become much more aware of the other opportunities available to you. So you can jump around once you've started. In the session card that we provided alongside this session, there is a really nice couple of quizzes that you can do if you're interested in looking into this a little bit more about what might suit you. You can do the quizzes, where your areas of interest are, what your strengths are, what you like less, and it'll give you some ideas about potential other careers within the health and social care space that might be a good fit for you. So I'm going to move on and hope this technology works. Let's hear from some of our staff about what it's like to work in health and social care.
Being part of the best day of someone's life and the fact that people always remember you and are grateful for the care that you've given is something that I don't think you can get from all professions.
You can educate patients, ensuring that medicines are prescribed, are effective, but also it's about empowering people to feel confident in both taking medicines and actually not taking medicines.
So the reason why I joined health and social care as a pharmacist is because from a very young age, I was very interested in medications and how they worked and how they impacted people's quality of life. So yeah, I wanted to help and I wanted to help people, and I was thinking about the kind of careers that would put me in a position to be able to help others.
The career possibilities are endless. My nursing journey has allowed me to gain an insight into so many clinical settings, both within hospital and in the community.
Get some experience in any part of the health and care system and you really see how challenging it can be, but also how extremely rewarding it can be as well. Talk to as many people that you know that might be involved in health and care and really get their perspectives, and that will help for you to get a better understanding of what your career options might be.
Give it a go, and if you don't find your niche straight away, don't give up as well, because social care is not one-dimensional. There are so many different versions.
Just take a chance and never let anyone dim your light or tell you that you can't do it.
Lots of career options,
but one shared purpose.
Join us in health and social care
and make a difference.
It's your future.
So we have lots of routes into our careers. We have entry-level roles right through to consultant or senior management, and all routes in welcome academic and vocational routes and qualifications. Sometimes it depends on the actual specific role that you're looking for. So if you've got a particular career in mind, it is worth checking out what their preferred entry routes are. Most jobs in health and social care require English and Maths GCSE. Some require degrees, but not all of them. And that will obviously depend on the nature of the role that you're looking to go into. And volunteering is a really great way of building some experience up, getting some connections, building up your CV, but also really trying to work out what it is you want to do. I know that I, at 16, volunteered at my local dental practice because I thought I wanted to be a dentist. Very quickly realised it wasn't for me. So it was really useful that I didn't embark on a dentistry degree and then discover it later on that it wasn't the right fit. There is always something out there that will be a really great fit for you. Because of the range of roles, we have a huge range in salaries from entry-level roles right through to the most senior management, and you can progress really well in health and social care. That's one of the beauties of it, because we work together, because we are interconnected. Once you're in, you find out about all sorts of different roles that are available and that you can choose and switch across your career journey. I certainly started out as a clinical scientist, then did some research for a while, now work in workforce across Greater Manchester. So you can adapt and change, and it makes for a really interesting career journey. Equally, you might absolutely fall in love with one profession and stay throughout your whole career, and that's also absolutely fine. One of the extra things that we have in the health and care service, particularly in the NHS, is, as well as salaries, we also have a really great broader staff benefit package. So we get a lot more annual leave, holidays than most other jobs. We get discounts through things like the blue light card, and it saves a small fortune. And I realise you won't be thinking about this yet, but pensions, we have a great NHS pension service, and it means that lots of people can retire early. Many of us have the luxury of flexible working, so I work from home most of the week, which is something I really value. Obviously, some roles are less flexible. If you're working in a hospital patient setting or in a care home, that's less possible. So it does depend. But there's a whole range of extra benefits of working in our sector. And there's a great opportunity for further and personal development along your career journey. And to finish off, I just want to hear from some students who've been undertaking placements over the last year in our sector.
Yeah, my name's Charlie, and I did a T-level in nursing at Wigan College. One of the main things I enjoyed about the course was the people aspect of it, so talking to the patients, seeing them, recover and go back home. But overall, it was a really good experience for me.
Hi, I'm Rui and I'm a T-level mental health student there. So the best thing about my placement that I enjoyed the most was throwing myself in at the deep end and exploring all the different complexities of mental health nursing in the community and in ward.
Hi, my name is Bassam. I'm studying T-level business at Greater College. I'm honestly enjoying it so far. The networking and meeting new people. I have the potential of meeting the mayor of Manchester. I don't know if it gets more important than that.
So if you want to make a difference, come and join us. There's a role for you in health and social care. Thanks very much.
Oh, thanks so much, Sue. That was brilliant. We've got one question, if that's okay. So someone's asked, what support is available for young people who want to apply for an apprenticeship or T-level?
So there are lots of routes in. I would say if you want to work in your local area, get in touch with your local hospital or the setting you're interested in going in and see what apprenticeship options they have available. Lots of those organisations have widening participation teams, so they can help guide you through how to get in. Lots of them have pre-employment programmes as well that can help you get your first foot on the rung. And then in terms of T-levels, all of the further education and lots of sixth form college offer T-levels across Greater Manchester in a variety of health T-level settings. But of course, for the other non-clinical roles, there's a whole raft of other T-levels that are suitable: finance, business admin, etc. So lots of opportunities. Contact your local college and your local employers.
Oh, brilliant. Thank you. That was a great answer. I think really helpful for the young people listening. So yeah, I just want to say a huge thank you to Sue for sharing your story, and thank you to all of you for joining us. You should already have a session card to help you explore more about health and social care, like Sue mentioned. But if not, please ask your teachers to share this with you. GMAX is your Greater Manchester Apprenticeship and Careers Service platform, where you can find out lots more about careers, apprenticeships and opportunities open to you. Many of you will already be using this, but please speak to your teacher to find out more. For teachers, parents or carers joining us today, I've added a link into the Q&A to our feedback form. Please take a moment to complete this on behalf of your students and children. Your feedback is important to us so we know how to improve for future sessions. And I just want to say thank you again for joining us, and I hope you all have a fantastic morning.